My name is Raúl Pardo, and I'm an assistant professor at the IT University of Copenhagen. My research is focused on online privacy, and now recently I'm working on privacy for data analytics. Data analysis is bringing a lot of benefits to society, but sometimes it's difficult to understand what are the privacy risks that releasing that information can pose. And my goal is to use program analysis to quantify this. In 2003, researchers managed to sequence the human DNA, and this produced an enormous amount of information. What scientists have done with this information is try to correlate genetic data with phenotypic information. Things like how likely it is that I'm going to have some disease, like Alzheimer's disease or cardiovascular disease. On top of phenotypic information, there is something called polygenic scores, polygenic risk scores, that are also based on genetic data, and they try to summarize this phenotypic information. So why is this information interesting? The reason is that this can bring a lot of benefits for medicine. So people can take their genetic data, bring it to their doctor, and the doctor can use that information to provide better diagnosis, more accurate diagnosis, and better treatments. There is a moment in this story where you need to share your data. Maybe with your doctor. In principle, sharing the data with your doctor is fine, but if we want to really take advantages of this technology, we should be able to share the information, for instance, among hospitals or with pharmaceutical companies that can improve their medicines. But then we are at the risk of the privacy of the individual, because you can share the information with your doctor, you trust your doctor, but how can we trust another company, a third party, that yes, they have, their aim is to bring some benefit to us in medicine, but they can also misuse this information. For instance, there are cases where health insurance companies have denied health insurance to some people for which they have access to their gene information because they were more likely to have certain disease. So we want to prevent this kind of discrimination and also identification. So your genetic information is extremely identifiable, very easy to know to whom it belongs. And if this sharing of information is done in a careless manner, is problematic because it will bring more problems than benefits. So the way I would like to help is by giving doctors or data analysts and anyone that computes some statistics, give them tools to quantify privacy risk automatically. So to understand what would be the risk of releasing a piece of information or some phenotype or some polygenic risk score, what is the risk of releasing this information for the patients? Because I see that this type of data is not used with the care it should be. There is also social networks, specific social networks where people share their genes. And this is extremely dangerous because when if you share your genomic information in plain, you are disclosing a lot of private information that can be used against you, not only about you, also about your relative. So what I hope is that with this type of work, we help people understand the risks. And when people understand the risks, we hope that there can be methods in place to prevent any misuse or misrelease of information.